First, I want to thank the Montgomery City County Public Library System and here at the Juliet Hampton Morgan Memorial Library for this collaboration with NAMI, the National Alliance on Mental Illness, and for the digital programming you're making available to help those living with a mental illness, especially during this pandemic. My name is Kym Klass, and I serve on both the NAMI Alabama and NAMI Montgomery Board of Directors, and came to know the organization as a reporter in Montgomery when covering mental health issues. I grew to know them further and became involved with them after my sister's 2015 suicide. NAMI is the nation's largest grassroots nonprofit mental health organization. It provides advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can build better lives. It provides programs and services for those living with a mental illness and their families, such as In Our Own Voice, where you hear from people who live with a mental illness. I participate in this program and talk about my depression and how I live with it, through it, and manage it. Other programs include NAMI Basics, an education program for parents and other caregivers of children and adolescents living with mental illnesses. Ending the Silence is an in-school presentation designed to teach middle and high school students about the signs and symptoms of mental illness. Hope to recognize warning signs and the importance of acknowledging those warning signs. NAMI Connection is a weekly support group for people living with mental illness and where they draw on other people's experiences, where they share coping strategies and offer each other encouragement and understanding. 1 in 5 U.S. adults experience mental illness each year. 1 in 25 U.S. adults experience serious mental illness each year. These include depression, anxiety disorders, bipolar disorder, PTSD, schizophrenia. We know our mental health has been affected by COVID. Isolation. We have felt the isolation, the feeling of losing control of where we're able to go. We're being told to not touch, no hugs, no handshakes. We can't even stand closer than 6 feet from each other. We can't visit the elderly in nursing homes. Isolation is everywhere. Even for those who consider themselves introverts, the isolation has been difficult. And for those living with a mental illness, even more so. Gone are in-person support groups, visits from friends, and meetings have turned online via Zoom. We're all doing it for the mental health reasons and even through professional engagements. The Centers for Disease Control and Prevention stated that while pandemics can be stressful, that fear and anxiety about a new disease and what can happen can be overwhelming and cause strong emotions in adults and children. Coping with stress in a healthy way will make you, the people you care about, and your community stronger, according to the CDC. People with pre-existing mental health conditions should continue with their treatment plans during an emergency and monitor for new symptoms. We should look for these signs of distress. Feelings of fear, anger, sadness, worry, numbness, or frustration. Changes in appetite, energy level, and activity level. Difficulty concentrating and making decisions. Difficulty sleeping or nightmares. Physical reactions such as headaches, body pains, stomach problems, skin rashes. Worsening of chronic health problems. Increased use of tobacco, alcohol, or other drugs. If you need help, NAMI hosts online community discussion groups where people exchange support and encouragement. All you have to do is create a free NAMI account to join one. Contact your local NAMI affiliate, such as NAMI Montgomery, at namimontgomery.org. to see what online and other resources are in your area. The CDC offers steps to cope with a disaster. 1. Take care of your body. Eat healthy, well-balanced meals and exercise. Avoid alcohol and tobacco and other drugs. Connect with others. Maintain healthy relationships. Share concerns and how you feel with family and friends. Take breaks. Make time to unwind and remind yourself that strong feelings will fade. Avoid too much exposure to the news. Watching, reading, or listening to news stories can be upsetting to hear about the crisis and see the images repeatedly. Connect with your community or faith-based organizations. If not in person, then online, through social media, or by phone or email. Also, try to do some other activities that you enjoy. Call your healthcare provider if stress gets in the way of your daily activities for several consecutive days. On a personal note, to take care of my mental health during this pandemic, I have gotten into my car and have driven to the mountains for a day just to hike. It allowed for some social distancing, but more importantly, it got me out of the house to clear my head, to get out of routine, and to decompress. Another friend of mine spent a weekend at the beach at a condo unit that didn't allow children, so she knew she wouldn't fight a younger crowd. I recently traveled to Texas, where I call home, and with my dog, hiked trails, walked paths, visited a winery, and had dinner with family. I didn't have a depressive episode all week. It was what I knew I needed. That is so important, to identify what you need and then do it. After quarantine began in March, I waited until June and Father's Day weekend to visit my father in Florida. To help me mentally prepare in a world of COVID, I quarantined for 2 weeks before seeing him. Not feeling safe flying yet, I drove and relished in the solitude on the road. I wanted to share another personal story that is online via NAMI, and how this person has coped during this time, and I hope it brings some encouragement to you. This person writes, COVID-19 has impacted my mental illness. Though there have been many other situations that affected my mental illness as well, not just the virus. I am a senior in high school who was supposed to be graduating on the 21st of May. I lost my brother to suicide that year. I completely lost myself for months. I felt so guilty that I wasn't a good sister. I can't seem to forgive myself. If there was something good in life to help me reassure myself, it was graduation. I looked forward to it, because when my brother was here, he believed in me. He motivated me. He promised me that he would be at my graduation. He told me he was happy for me. I wanted to walk that stage and look into the sky once I received my diploma, to tell him that I did it, not only for me, but for him. My brother had a rough childhood. He dropped out of high school, but I was going to receive that diploma for him, since he didn't get to receive his own. COVID-19 left a huge impact on me. When I found out school was being closed for the last 2 months, I cried. I felt so bad. For some reason, I felt like bad luck. School always kept me busy and not overthinking things. Now during quarantine, it's like all I have is time. Time to reflect on that day my brother took his life. But I know I'm not alone. I know others have been affected too. And I personally just want to say condolences and prayers to any of those who lost family members during this pandemic. I hope you all stay strong, as I will too. And another story I found came from England, actually, and and it offers a little bit of guidance on how we can handle our time during this quarantine with our mental health. This person writes, "For some of us, pre-pandemic anxiety levels were exactly the sort of thing everyone experienced in the depths of the crisis. Let's try not to forget that. In fact, those of us who had existing problems with anxiety may well have been having an awful time throughout the pandemic, with even more difficult thoughts and feelings than before, which increases the challenge of adjusting to our, quote, new normal. So what can we do to help? Try these 3 simple steps. 1. Summon your fear. Remember your darkest moments during the pandemic, when you felt panicked or overwhelmed. Keep that memory ready to retrieve so that you can feel into it and remember how it affected you physically and emotionally all the time. Be grateful. Don't be shy. It's healthy to feel grateful. You had a rough time and you got through it. Show yourself that self-compassion. 3, extend that compassion to others, to that person in front of you who is still stuck in the middle of their anxieties. A smile or a kind word might make that person's day, but the beauty is you don't need to do anything. Just don't honk your horn. Don't roll your eyes. Don't post snarky comments on Facebook. Just wait. We've all had plenty of practice waiting over recent weeks and months. A lost skill we have hopefully relearned. If someone is frozen and overwhelmed at the supermarket, if your friend needs several attempts before they can face meeting up, just wait. There is always time. I promise that if you follow these simple steps, not only will you avoid adding to someone else's anxiety, you'll have eased your own at the same time. Once you choose to stop judging others, you may quickly realize this, that you've also stopped judging yourself. It's a win-win. I'd like to offer some resources in case you need someone to call during this time. The National Alliance on Mental Illness helpline is 1-800-950-6264, Monday through Friday, 10 a.m. to 6 p.m. Eastern. If you or someone you know needs help now, call the National Suicide Prevention Lifeline at 1-800-273-8255 or call 911. If you want to reach a crisis counselor via text, the number is 741-741. Thank you.